Hey, what's going on, everybody? My name is Nicholas Wright. I'm a licensed professional counselor here in Virginia, and we have a special guest today, rocking with DeLon. You want to tell them a little bit about yourself? I don't want to leave anything out.
Yeah, man, sure. So I'm Dr. DelonCanterbury. I'm the CEO and president of Geriatrics, which is a medication management company focusing on saving you thousands of dollars in healthcare. We specialize in medication deprescribing and finding complex solutions to really hard healthcare problems. And we love doing it. We save our patients money and then we leave them empowered on how to advocate for themselves.
Oh, that's awesome. That's awesome. So we're going to kind of talk about, when is it time to start taking medications? I have the counseling perspective, so I deal with the mental health demographic a lot, and I work specifically with opioid addictions. And, we're going to talk to the doc and kind of gain more insight on it. And we're going to kind of transition into talking about tapering and how that kind of works. So I guess speaking of, here's a popular one I got on my list. You ready?
Yeah, sure.
How do you get off of Xanax? Oh,
Ooh, that's a fun one. That is a fun one. However, it's not impossible. So and it depends on why you're taking it, right?
mm,
So, of course, when you stay on something like that, just like alcohol, you get a tolerance effect. And after a while, your body just kind of needs it. It becomes dependent in a way. So what we have to kind of do is one, really incorporate cognitive behavioral therapies while we're trying to taper people off of these things. It's not easy to just stop something cold turkey. In fact, it's actually harmful to stop that medication cold turkey. You definitely don't want to do that. So this is a medication you want to have a provider work with you on slowly taking you down in doses. You can do it different ways. You could do it from, hey, if I was on it 2 times a day, let's start with one a day or one and a half. We can also space out the dosing. So say you were taking it twice, you can, alternate on days, see how that does. Again, it's tricky depending on which medication we're talking about, but it is possible. So even though you may have people that are kind of dependent on it, you just got to work with your provider and your pharmacist on ways to gradually get you taken off to where you don't need it anymore.
awesome. Yeah. So I know from the counseling perspective, we really focus on increasing those coping skills and just trying to help people identify those maladaptive patterns that are kind of stopping them from moving forward. Whether it's changing your phone number, changing that circle, changing your work environment. One of the big ones right now is signing off of Facebook Messenger. Uh, People have a way of finding you that you weren't expecting to. Another one is Klonopin. Is there, I guess, how do you get off of Klonopin? Because that's another big one that we have people say, "Hey, I was prescribed this when I was 13, and
Mm-hmm.
now I'm 34, and I want to get off." And they're trying to work with me to taper, but I'm somewhat scared. I'm apprehensive, like shortness of breath. What are your thoughts?
Absolutely. So Klonopin is another one in the same family as Xanax. So really, it'd be the same advice I just gave regarding slow and gradual. It does depend on what people are using it for, but honestly, you got to work with someone with a plan. You cannot stop it cold turkey. It depends on how you use it. You have to tailor it, and it's really a fine art. It's not like an easy science. Like it depends on who the person is, what they're using it for. So again, I advise that you work with your doctor closely. And then we want to get to the root reason of why are you on Xanax? What are you using it for? Do you have panic attacks? Are you just using it to fall asleep? Have you just been on it, like she said, for years and forgot? We don't know. So the question is, what's the plan and how can we safely get you off?
All
And
right, so
it's possible.
So talk that talk. Talk to him about the stuff you were kind of telling me before we started recording about genetic testing and your company and how you guys kind of have a different approach. And how would you, I guess, what information are you looking for as it relates to maybe someone on Klonopin or Xanax and trying to taper?
Well, the first question is, how ready are you to get off of it if you don't need it? So that's a question you want to ask yourself. You don't want to take somebody off of something they don't want to be taken off of. Now, mind you, there's some cases where it's harmful and they're just in a state where they're dependent and you just think they need it. That's a whole different situation. But if you're literally ready to get off of these meds and find a safe way to do it, it is possible with having a pharmacist and your provider talk through that, and your licensed counselor, of course, to talk through those steps. That being said, what we offer is genetic testing. And what that means is we can figure out which medications are best for you and your body. Traditionally in medicine, we do it the old way, which is, hey, let's give you this pill and see what happens. We've been doing that for 100 years. It's old, it's outdated. Now, what we can do is get your body sample, which is a cheek swab, and it can tell us, okay, you should not take Klonopin. You should take this drug, or you should not take this mood disorder drug because it would cause more side effects. So now, instead of us just saying, hey, let's try it out and see in 3 months, especially with psych meds like mood and depression disorders, we can now have a better approach. So you're not going through 6 months of trying a new drug and not knowing if it'll even work or not. Now we know up front before we prescribe, hey, look, you should probably try this first. And then we can ease really the transition to care.
Wow, are you seeing a lot of success with this?
Oh, absolutely. This is a cutting wave of healthcare. This is something that isn't going away. In fact, it will be the staple in a couple of years, but this is what our patients benefit from. We're seeing it in cancer, we're seeing it in pain management, we're seeing it in anxiety and depression. You can name it, but pretty much everyone has a different body. And that's why knowing what genes do what can really help you.
Okay. Now, I don't want to jump too far ahead, but I mean, let's just do it. So I guess that's a good segue into the ADHD thing in minors, especially in the African American culture. Is really cliche. Um, it's like ADHD medication for a kid. How could you do that? And then you have some parents, they do it openly and they stand on why they do it. And then you have some parents that are like, I don't tell people, but I give them ADHD meds. It helps. Or you hear about people not I don't want to say self-medicating, but giving their kids melatonin gummies like it's Skittles to go to bed. So, I mean, does the genetic testing help with that? Or, I mean, what are your thoughts on that?
It's interesting. So genetic tests can be used for any age range, any group, and it lasts a lifetime. So you're getting a lifetime of value from just one test. And the good news is it's covered by most insurance. It's covered by Medicaid, it's covered by Medicare, and most major insurances as well. So to add to that, it has value across the board. Even if it's not just ADHD, you can have this cheat sheet for life that can tell you, hey, look, you're not good on these drugs, or hey, look, you should take these drugs, or you're okay with that, but we don't know enough yet. It gives a breakdown of what's going to help you down the road. And there are times where some of those ADHD meds are affected by those same genes we talked about. And when that happens, you find people either giving super high doses or super low doses because they don't know the genes behind the machinery.
Well, I mean, when you said Medicaid, Medicare, I feel like you spoke to a large percentage of the nation.
Yeah, yeah. And that's how important this is, because they're realizing this is a needed service, and that's what we provide with geriatrics.
All right, now, how do you figure out like how to manage like SSRIs?
It honestly comes down to the same thing. So here's what usually happens when people are talking about SSRIs, which for those who don't know are serotonin, Jesus, serotonin reuptake inhibitors. Selective serotonin is the fancy nomenclature. But what that means is it's rewiring your brain to help shoot some more chemicals so you get more emotion, more happiness, a little more joy in your life. And with SSRIs, particularly because this is a main reason why people would use the gene test to figure out what's good, is that a lot of those drugs, they go through two major pathways that can cause issues. And what you'll find is that there are people who, okay, let's try this SSRI. And then you go on
Zoloft.
after, Yeah, yeah, you go on it exactly. You go on like Zoloft. You go on it for 3 months and you feel the same. Or you try it again with a higher dose for 6 months and you feel more anxious or worse. And when that happens, even though it is a risk with the drug in itself, all of them can cause that. We don't know for sure if it's just your genes saying, hey, I was never meant to have this drug. I should have been on that Prozac. I never should have been on the SSRI to begin with. So this is the beauty of getting a gene test before you start taking drugs, because now we know what's better for you versus not.
All right. Now, for the lay individual, SSRIs and antidepressants, I guess my thoughts are: how do you go about obtaining this type of gene therapy? Like, are you guys sending a kit to people's houses, or, I mean, how does that work?
Yeah. So it's super simple. This is a significant or a signature service that we offer. We partner with a gene testing company. All your information is completely secure, it's safe. The kit gets shipped straight to your home. So the minute you talk with us and we walk through just your insurance or your address, the kit is shipped straight to your home and you get results within 3 to 5 business days. So after those 3 to 5 business days, I get an email saying, hey, DeLon, here's your report for XYZ patient. I meet with the patient and then we talk about the report together. And the best part is I tell your doctors about the report too. So now they have it on file and they can make a decision with it.
Okay, wow. Yeah, that's um, super user friendly and extra convenient. I really
Yeah.
didn't think it would be that easy.
Mhm.
So what do you say to the I guess like the conspiracy folks out there, like, oh no, I don't want to give them my information. I don't even like doing the census test. So it's like, I mean, I know that's Stone Age. I mean, those are also some of the same people. Well, I kind of categorize in some of it in terms of we take ginger ale as medication.
Mhm.
So,
Right. My mom does too. So I don't knock it. And I do the same thing too if I got stomach upset. So it's no judgment. And there is some science behind it too. But, we got to get to the point where we have to use technology in our favor. We already are doing it now. We're already using Zoom. That's like a common English word now. And why not let the best part of science help us make the best decisions? That's how I feel about it. I would not want to start 4 different meds only to find out on the fourth one that was the one that worked for me, right? Who wants to go through that headache? Who wants to go through that time you're going to lose in going through side effects? Who's going to want to go through those copays and added costs that you're paying out of pocket just to find out it don't even work, you know? So when you put things in that perspective and you have a way of getting an answer up front, why not make that choice?
man, you got a way of making me want to do it.
We can set that up, man. It's as easy as you think. It's really not hard. I did it earlier today. It takes me 5 minutes to order it.
Okay, now where does the information go? Does it go to just my doctor, or does it go miscellaneous places? Like, is it open to the Census Bureau? Is it, is the
Mhm.
government, just for those conspiracy people? Just to be plain and clear, I understand HIPAA,
Mhm.
but what type of release? Like,
Yeah. No, the report goes to the patient. That's it. It goes to me first because I'm the provider. I'm a pharmacist, so I have that legal right to share that information. But you disclose where you wanted to go. It's your report. I don't share it with anyone else. Of course, the company that makes the report has that on file, but they're not sharing that with anyone. This is a private company that's just focused on saving people money with healthcare costs. So for those worried about that, it's rest assured it's completely safe. It's a simple cheek swab. It's easy. You put it in a kit, you ship it, you get answers in a couple of days. So in terms of your information, it's completely safe. And I won't share with anyone unless you want me to. And generally, I'll ask you, hey, do you want me to share this with your provider before I go ahead and do it? Because I want you to have that permission, and that's how providers should work.
okay, man, that sounds awesome. Um, it kind of makes me want to segue into culturally Molly Percocets, right?
Mhm.
That was a huge hip hop song, like, and it to the point where it had a lot of people taking Percocets.
Mhm.
And now, there's opioid addiction and those sort of things. But how do we convince someone? Can someone taper from Percocets. How would you suggest someone tapering from Percocets that doesn't want to do treatment?
So it's doable now. Again, this is a multi-layered question. You
Okay.
got to have people on board. You got to have a team helping you and
Mhm.
looking out behind you. It's not just let me just start one and done and do it myself. It's really difficult to do it by yourself. So one, you got to have a team. You got to have a counselor. You got to have a provider, a substance abuse coach, someone to help you through the process. Is it possible? Absolutely. I think anything's possible to taper off of things. But when I hear Percocet, a lot of my concerns, apart from the chances of just spontaneous death and your lungs just not working and other risks, is there's also a huge
Whoa, wait
amount.
a minute. What? What about that? So a cold turkey from Percocets can cause spontaneous death, lungs exploding?
No. I'm saying abusing Percocet, which is an opioid, can cause your lungs to stop. So using Percocets is an opioid. So Percocets are oxycodone and Tylenol combined in one. And an oxycodone, when you abuse it, that's what can cause your lungs to just stop.
That's
Uh,
that lean, that
yeah,
syrup.
yeah, no, the lean. Well, yeah, I mean you could put it in there, but the lean is usually the codeine. Lean is usually promethazine and codeine mixed with Sprite and some other stuff. So I'm not here to give y'all recipes, but I'm trying to let y'all know that there are ways that you can get off of those drugs.
Okay. Yeah. And I think of I mean, you want to kind of talk to how it's a respiratory depressant and mixing it with alcohol.
Yeah, sure. So especially with alcohol, one thing I like to describe alcohol is like it's like an amplifier for other drugs. It just unfortunately it can really it's a depressant, but it can really worsen how opioids and Xanax or benzos work. And what that means is you can have a higher risk of the ODs when you combine like Percocet and Xanax or clonazepam. All of those can lead to your normal lung function from just stopping, because what it does is it slows it down. It slows it down in general because your body's telling it to calm down. And so the muscles used to make things just grow and expand your lungs,
Mhm.
they don't do that anymore when you're high on those substances because they're working, they're just doing their job. And when that happens, you can, and that's what we find is people OD and die in their sleep because they've lost lung function.
Wow. Yeah. So you're hearing it straight from the doctor's mouth. Can't make that up. We see it all the time. Recommend connecting with your health department if you're out there. Get you some Narcan, naloxone, and see about having some in your house. Um, and lastly, I wanted to ask you about gabapentin.
Mhm.
Once upon a time, I want to say like last year sometime, I remember getting an email from the DEA telling us to watch our patients on gabapentin because they were looking at the abuse potential.
Mhm.
Um, and then I start to see it pop up more frequently with my loved ones, and they're like, "Yeah, my doctor prescribed me gabapentin."
Mhm.
Now I'm not seeing, but then I work at an opioid addiction treatment center during the daytime
Mhm.
and private practice in the evening. So during some of my sessions with patients who experience opioid addiction, they say my doctor gave me um, gabapentin for my fibromyalgia, but it's not touching anything. It's
Mhm.
not doing anything for me. So I guess loaded. I guess that kind of comes into two questions. Do you think gabapentin is addictive? Does it have an addictive principle? And then two, um, does it work? I mean, I guess it works, but what
Yeah,
is
it's a loaded question because it's going to depend per patient. One, if you're talking about fibromyalgia, that's already a very difficult disease to treat. So that's already like maybe first or second tier options, honestly. Two, gabapentin does work. Gabapentin, it just sometimes doesn't work for everybody. And that's something that I also want to stress is that um, it can have some great uses, especially in people who are diabetic or people who are struggling with nerve pain. It's a great nerve pain drug. That's kind of the name of the drug. It stops things in the GABA receptors, which leads to nerve signals. So the gabapentin has its effects. Does it have abuse potential? Yes, it does, but not as much. I wouldn't say as much, but it wouldn't be as likely expected as we see with the opioids and the benzos, which are Xanax and clonazepam. So regarding gabapentin, it can, but to your last point of is it effective? It depends on the person. It depends on what you're treating. It's done wonders for my patients, and I've seen some patients it doesn't do anything. And so it's just kind of a mixed bag.
All right, awesome, man. Dr. Canterbury, that's all I really have for today. I really appreciate your time and just kind of going with it on the fly. This was kind of fun. We have to do this again.
Yeah, man, sounds good to me.
All right, so how can people find you? Social media, things like that.
Yeah, man, I'm all over social media. You can check us out at Geriatrics, which is GERIAT. RX is an X-ray, geriatrics.org. You can follow us on LinkedIn, Twitter, Facebook page. That's where we get most of our content. We do free content pretty much every other day. You can find out ways you could save money on healthcare costs and prescriptions. Maybe you just want to meet me, just check out our website. My cell phone is right there, geriatrics.org. Get your free consultation. We can talk about it.
Okay, and if someone's saying like, well, I asked my doctor and my doctor's saying I don't need it. My doctor's trying to put me on an SSRI. I said, hey, I want to do gene therapy first. And they're saying, oh, you don't need that.
Well, that's the beauty is that we work with doctors. That's kind of the name of the game. So if they don't think you need it, that's up to them. However, let's look at the big picture. Again, do you want someone to just try something or do you want to know what's going to work? So do you have 6 months to wait potentially of trying something and not knowing if it's going to work? And then again, this is where we come in is we can educate the doctors if needed or talk to the patient. A lot of doctors are kind of like unsure because they don't know who's the expert yet. It's still kind of a new thing to them. But this is where pharmacists and providers can work together and get all of these questions answered. And it'll help them make the best decision. So ultimately, I would question a doctor if they have your best interest at heart.
Yeah, I appreciate you, Dr. Canterbury. This was good. This was heat. I appreciate this. Just dropping jewels off for the free. You don't get that too often from a doctor or pharmacist. So I encourage you guys to check out his email below. I'll leave it in the comments, and hopefully we can do some work together soon. All right.
Sounds good.